Hi, this is Dr. Dina Weiser, and it's a pleasure to welcome you to your site visit to WIC. Many of you probably know WIC through the many forms that you fill out as your children come in and you check off their weight and their immunizations. Did you know that WIC is a federal program administered by the United States Food and Nutrition Service? And the money is shared with states, and the actual WIC program takes place at many, many different state agencies. To qualify for WIC, women and children through the age of 5 must be at a certain income level. Typically, it's about up to 185% of the poverty level. This very important program was put into place because of the very real issue of food insecurity. So when it first started, there were many, many children who were simply not meeting their nutritional needs. They were not enough food to go around. While we live in an era of such plenty and we're surrounded by a major obesity epidemic, ironically, the truth is the food insecurity problem has not gone away. Did you know that 29% of children living in poor households actually experience some food insecurity? There's a very specific guideline which defines what food insecurity is, including parents being asked, have you ever felt concerned about your ability to feed your children? Have you ever been worried about where your next meal was coming from? And questions like this. So this remains a very real issue. So, what does WIC do? WIC is an amazing center that provides a variety of resources. Everything from education, including breastfeeding support and counseling, to education about nutrition, formulas, when to change to whole milk, what's appropriate nutrition, to other types of support systems and referrals to other really important community agencies to the parents and families that go to WIC. As you know, getting a child's formula for free is a great incentive for a parent to show up somewhere. So therefore, they do see a tremendous number of the women and young children that are at some significant social risk as a result of their poverty level. And so opportunities to screen them for all sorts of other important risk factors and refer them to the resources that they need at WIC is really, really important. Other thing that we really are looking for you to get out of your visit are what potential opportunities do you have as a pediatrician to contribute to or interface with WIC? Again, the simple one is being really diligent, of course, about filling out those important WIC forms that you get. The other piece is talking to your families about things like food insecurity and making sure that they are linked up with their WIC sites and you can refer them. There's a wonderful component of the New York Department of Health website that actually goes through whether or not somebody's eligible and lists the nearest WIC center. So that's something that you can access really readily. The other types of opportunities we're looking for you to get at your different community sites is to get a sense of what broader roles that you may play within them. So for example, we had residents working on a project around physical activity. And one of the things that we did several years ago was work with our local WIC sites in order to help them infuse guidance about promoting physical activity at a very young age. So they had been really well versed in talking about nutrition very directly, but we were able to sort of expand the scope of what they were doing to include physical activity. Are there other health elements that you think should be included? Can you do some education of the providers there? That is one opportunity. Another opportunity is, as you move forward in your careers, serving in the role of an advisor for a WIC program to help them structure how they deliver their services. And another very important role that you have as a pediatrician is as an advocate. Your voice as a public champion is very well heard. So funding for WIC is very, very important, and there will certainly be opportunities in the future to make the case for that, to advocate for that, and to really speak to the important benefits that WIC has to offer to their clients. So again, we hope you really enjoy your day there, and really get a lot out of it and try to explore what role you play in this scenario, to think about the nutrition and food realities that are experienced by so many of the families that we serve, and to understand the depth of the resources that they do provide. So that, for example, when a breastfeeding mom comes to you and you are able to refer them there specifically with very directed opportunities to have their breastfeeding be supported, that would be an important resource to know about.